Namaste everyone. Welcome to live stream sessions. So today I am going to explain about the topic of Stanya. That is, in our Ayurvedic term, it is known as Stanya. Normally, it is known as breast milk. According to modern, it is known as breast milk. So we'll discuss what is the benefits or what are the importance of this breast milk and how the formation or ejection of breast milk are held in a female, and what are the benefits of breastfeeding in mother and breastfeeding exclusively for baby, we'll see today. So food is the root cause of both health and disease in children, right? Not only in children, in everyone, the food is the main cause for the healthy person or a diseased person. So according to our Ayurveda, Acharya Kashyapa described Ahara has a Mahabhasaja. Bhasaja is nothing but, according to our Ayurvedic term, it is a medicine. So according to Acharya, he said that Ahara only is a Mahabhasaja. It is the main medicine to a healthy person to maintain their health. Means if we have taken any medicines, like if we are ill also, or in promotive or preventive aspect also, if we are taking any medicine, we want accurate food with that, nutritious food with that, then only that medicine will work on our body, right? For example, if we take a medicine in empty stomach without any foods, obviously it will not give result as we expected, right? Some medicines will be which have to take before food, but after taking them, like maybe antacidic, maybe Ayurvedic or modern, will advise to have in empty stomach. Then we'll move after some time, like 10 to 15 minutes gap, will advise them to have food. Without food, only medicine will not work on our body, right? So by keeping this review aspect, our Acharya Kashyapa said that Ahara has a Mahabhasaja. So you all may be thinking, she said she is going to explain about the breast milk, but why she is explaining about the food, right? So because I'm giving the importance of food first, because as we are dealing with the breast milk, our infants, especially the newborn babies from birth till 6th month, they will be dependent on exclusively breast milk. Nothing but their ahara only is breast milk, right? So I explain what is this ahara and what's the importance of ahara first. Nothing but in infants or in newborns from till 6th month, the breast milk only is main component for their health. Maybe ill health or nutrition or developing nutritious health, everything. Their whole and soul is dependent on breast milk, right? So considering this as a concept, I am explaining the breast milk concept now. Like, obviously, we all know that when should start the breast milk, how many days we should do that, right? Immediately after birth, within 2 hours, we should breastfeed a baby as much as actually within 2 hours, but as soon as possible. If the woman gets breast milk within half an hour, then immediately she can go for feeding. But some women will not get breast milk till 3rd day or 4th day. They can wait, but if you didn't get breast milk also, don't don't put fully the nipples from the baby. For every 2 hours or 3 hours, try to give a nipple on the baby's mouth, so that the baby will sufficiently will suck the nipple. It will stimulate your mind and hormones, and it will the lactation will start soon. So as soon as possible, within 2 hours, try to give a breast milk for the baby. And as the breast milk concept we are discussing, breast milk is the first shot of vaccine to a babies. That is the colostrum. First 3 to 7 days, what we get, the thicker and yellowish one breast milk is known as a colostrum. This colostrum is a first shot of vaccine to a baby. It will create the immune system strongly to function strongly in a babies. So as soon as you get the breast milk, kindly give. And some people may think that starting breast milk will be thicker and yellowish, it should not be given. No, confirmly and continuously you should feed a baby. Don't express it. Just wash your you can wash your breast because of delivery process, everything. It may be infected. So you can wash your breast and immediately after delivery, as soon as possible, start to feed your baby. Because these are the breast milk is the main concept to boost the immune system of a baby, and the pulley maybe for nutrition, and maybe for the satisfy the hunger of a baby. Baby will be fully dependent on breast milk, right? So you should give breast milk exclusively till 6 months, only breast milk. Don't wean or don't give any extra foods rather than breast milk, one thing. And if some women are not getting sufficient breast milk, they can go for formula milks or any other alternative milks if insufficiency of breast milk. And some people, what they do, even though they have sufficient breast milk, they feel that baby is not getting sufficient breast milk, so we should go for alternative milk, maybe powder milk, formula milks they will go, or maybe alternative cow milk or goat milk they will go. You should not do this, because the maybe you are not getting the qualities that baby is having sufficient breast milk. That we will see, that what are the qualities of nutrition that baby is getting a sufficient breast milk. Qualities in a baby, that is, the baby will be happy, one thing, and the baby will be well built. Well built is nothing but the baby will be gaining the satisfactory ideal amount of weight according to the baby's age, and the baby will be having good sleep and good sound. Sound is nothing but like cranky. Baby may not be cranky, but the cranky and this sleep depends on other factors, not only on hunger. If one of the concept is, if baby is getting sufficient breast milk, then baby will be without cranky and baby will be having sufficient sleep. And the baby will not becomes ill health repeatedly if the baby is getting sufficient breast milk, because the baby will be getting sufficient nutrition, right? And the baby will be enthusiastic, energetic, and the baby's immune system will be strong. That overall, the baby, if the baby is getting sufficient breast milk, then baby will be overall active and with good sleep, with weight gain, everything. The baby will be calm and cool. These are the qualities that baby is getting sufficient breast milk. Then vice versa of this, qualities of baby who is not getting sufficient breast milk. Some mothers may feel that I have sufficient breast milk, but baby may not getting a sufficient breast milk. The qualities may be, or features may be vice versa of qualities of nutrition, right? The baby will be cranky always, and the baby will not sleep for the longer duration. If the baby sleeps also, baby may get up due to hunger. The baby may get up frequently, in within 1 hour, 1.5 hour, the baby may get up, will not sleep for longer duration, and the baby will not gain weight according to age. We know the ideal weight, right? The baby should be doubled when completion of 5th month. The baby should be doubled of birth weight, and when baby completes 1 year, it should be tripled of birth weight. This is the ideal range of gaining weight. This will not cover there if baby is not getting sufficient breast milk, and the baby will be less active. Active here means newborn babies will not do any activities, right? Just the calmly sleeping or movement of extremities, these all will not be in newborn if baby is not getting sufficient breast milk. And obviously the baby will be always cranky, means irritative, crying. The baby will be cranky always if baby is not getting sufficient breast milk. These are all the qualities if baby is not having sufficient breast milk. So the qualities in a baby we saw, but we should know how the physiology of this breast milk production is there, and what is the physiology of ejection of breast milk. Though you are a layman, like any medical people will not be seeing my video, any layman is seeing also, they may think why we need physiology of production, physiology of ejection, right? You all may be thinking. You should know, because if you know how the physiology of breast milk production is there and how its ejection of breast milk is there, then obviously you will be having idea that what all steps we should follow to give a nutritious lactation to the baby. Or in some women will be having insufficient breast milk. If they follow these steps, or if they follow these points, then they may get the sufficient breast milk, right? So I'm explaining the physiology. First of all, physiology of Stanya formation, that is in our Ayurvedic term it is known as Stanya Nirmana. How this production of breast milk is happening in a female's body. Ayurvedic classics claim that the effective establishment of lactation occurs only after 3 days of delivery. 1 point. And when Rasadhatu is subject to transformation in Prasuta Avastha in a female, its Sara portion in breast region is known as Stanya. This physiology starts since time of conception. What our Acharyas is saying, Rasadhatu here nothing but are nutritious. Whatever we are taking diet, we know whatever we take diet, it will be transformed into two portions. That one is nutrition one, which go for our build of a body, like blood, nutrition, fat, everything. And another thing which are another thing is excreta in the form of urine, feces, sweat, everything, right? But in pregnant women after conception, what will happen? Whatever the pregnant woman is taking diet, it will be divided into 3 portions. That is, especially the nutritious one, excreta you leave. The nutrition of a pregnant woman will be divided into 3 portions. One is for her body nutrition, one portion is for nutrition of a fetus, that is nothing but baby, and another portion is for production of breast milk. This nutrition part will be divided into 3 types, 3 portions in a pregnant woman, that we know, right? So this nutrition one portion which is kept for production of breast milk, when this Rasadhatu nutrition transformation takes place and nutrition part go for the breast region, that breast region nutrition part will be converted or converted into production of breast milk. So this is the physiology. But here not only diet, even the activities of a mother and even the emotional part of a mother takes an active part in production of breast milk. That is for sure. This is about the production of breast milk. But next is the physiology of milk ejection, that is Sanya Pravritti Hetu. According to our Ayurvedic term, the milk is ejected from breast by thought, touch, sight, and physical contact of the baby. We know it, right? Obviously, when we have more affection towards the baby, or maybe production of breast milk, maybe, or the ejection of breast milk, baby will be active part, will take an active part. But here again the emotional part of a lady and the diet of a physical part, nothing but diet of a lady will be the main point. If she is having a correct diet, nutritious diet, obviously the production of breast milk will be good, and due to touch or emotional status of a mother will be result for the ejection of breast milk. And this is about the Ayurveda. What are modern explanation about this physiology of breast milk production and ejection explains? According to modern, the 2 main hormones plays the role here, that is prolactin and oxytocin. Prolactin hormone is nothing but which works in the production of breast milk, and oxytocin hormone is nothing but which gives results or works in ejection of breast milk, that is downward reflex. When the baby mother is having good diet, this prolactin hormone, if it is playing an active role, obviously there will be the production of breast milk will be good. And if the oxytocin hormone is playing a good role, then obviously the ejection of breast milk will take place in a good form. This prolactin and oxytocin hormones work is main in the production and ejection of breast milk in a pregnant woman or a woman after delivery. So obviously, if these two hormones we need to give a good result or in a good condition, the physical status of a lady and emotional status of a lady after delivery should be good. Then only the this lactation, overall lactation of a mother will be in good condition. Rather than these, some percent of women will be having, like maybe the genetic issues, they will not get a sufficient breast milk, or any health issues, they will not get a sufficient breast milk, or even the hereditary, some part of hereditary also plays a role, they will not get a sufficient breast milk. In such conditions we are helpless, so you can go for the alternative milk to subside the hunger of a baby and to give nutrition in one or other way. You can go for the formula milks. Now we saw what is the physiology of milk production and ejection. Coming for the Stanya Sampat, that is Stanya Sampat, here nothing but ideal qualities of breast milk. What are, now we saw the features of nutrition in a baby, but we don't know what are the ideal qualities of breast milk, right? So the result here is one another the same points, but the concept depends around the state of health of the lady. Lady is here nothing but the delivered woman, because as we came to know, her diet and her emotional status plays the main role here. The health status of a woman plays a very important role. If she is healthy with physical and mental qualities, then obviously the her breast milk will be ideal qualities, right? Production and ejection of breast milk depends on the both physical, emotional, and surrounding status of a pregnant woman. Features in a baby of ideal qualities. If the mother is having ideal qualities of breast milk, nothing but like according to our acharyas, they give some 5 to 6 points, that it should be Shanka Vabhasa, that is nothing but white in color. The particular Anjali Pramana they gave, how much the quantity should be, and color, sorry, the smell of a breast milk, how it should be. These are from like a thickness, the slimminess of a breast milk they gave. These are 5 to 6 points according to Acharya they explained. With these ideal qualities, features of a baby of ideal qualities. So if the baby is having ideal quality of breast milk, what all qualities in a baby will be? Same as the qualities of sufficient breast milk, that baby will gain a weight correctly according to age, and baby will become ill in less portion. Obviously the children will be having less immunity power, but with that also the babies will be having less ill health. Then the baby will be active and calm, the immune system of a baby will be strong, and the baby gains healthy weight gain. Why I am mentioning healthy weight gain is, in breast milk, whatever the baby is gaining a weight, they will gain a healthy weight gain. You may be observed, they will not be over chubby, or they will not be like doll, like what we say, like dolls. The puffiness will not be present more who is having exclusively breast milk. You can see, but again it depends on the genetic factors and the health of a baby. But the when you compare with the formula milk babies, the formula milk babies, though they are chubby, the puffiness will be more. If the breast milk babies also, if they are chubby, the only fat will be filled. But what about the formula milk babies? They will have the puffiness in the chicks, or puffiness in the fats. So that is not a healthy weight gain. Just they are gaining weight with the formula milk, but it is not a healthy weight gain. But through breast milk, the babies will gain healthy weight gain. So coming for the last portion of the breast milk, that is Stanya, that is we now I said you should have exclusively breast milk, you should give exclusively breast milk, and how the breast milk is formed, like physiology of breast milk production and physiology of breast milk ejection. And I explained the qualities in a baby if they are getting sufficient breast milk. These all explained. But all may be having question that though the baby is getting nutrition or immune system strong with the breast milk, we can give these all through other alternative feeds also, like formula milks or any goat milk, cow milk. With these also we can give. Why there is necessary to give only breast milk only? What are the benefits to baby and what are the benefits to mother? Everyone will be having this question, right? Because what are, especially these generation people or women will think, by breastfeeding I may lose my complexion, or I may lose my charm of a face, or the body structure will be deferred due to breast milk. My breast will become saggy due to breastfeeding. So these all negative points, what it will create, they will stop the breast milk either, or what they will do, they will give a breast milk for lesser duration, and they will go for formula milk for like for example, in a day once or twice they will give breast milk, and rest times they will go for formula milks. And even in night also they will think that they will get disturbed of sleep. So what they will do, they will hand over the baby to mother, that is grandmother, and they will sleep. This is not the uh, pattern what you are following, because it will hamper your baby's health and even your health. So we'll see what all the benefits we have from the breast milk or by giving breastfeeding. Benefits to baby, that is, one thing is it is naturally soothes the baby when hunger, because if the baby is hunger at the night or any other like in outer environment, obviously if the baby is feeling hungry, if you are breastfeeding, you can go a separate private area and you can feed. It's obviously it will soothe the baby naturally. But if you are not feeding breastfeeding or breast milk, if you want to give formula milks or any other feed, you should roam here and there, right? One thing. And help baby to build a strong immune system. We saw this point in last points only. And has right amount of nutrition, because in maybe in formula milks, or if you are giving any other milks, we don't know how much amount of nutrition is present in that particular milks, right? But breast milk is obviously depends on our diet. Whatever we are taking, obviously nutritious diet will be hand over to the baby. And lower the risk of SIDS. What is this SIDS? Sudden infant death syndrome. This will be lower risk who are taking the exclusively breast milk in a babies, and lower the risk of obese and allergies. As I informed in last point, the obese means due to breast milk, the babies will gain healthy weight gain. So there will be lesser risk of obese. And heightened brain growth, obviously due to bonding or due to emotional bonding of a baby with the mother, the exclusively breastfed babies will have the brain power, like higher brain power they will be having, like maybe the memory power or the intellect, or maybe the grasping power. These all will be higher compared to formula milk babies. And coming for benefits of the breastfeeding to the mother, what all mothers will have the benefits to the exclusively breastfeeding. One thing, bonding with the baby will increase. Obviously, if we are feeding some, like you may be observed, especially in new mothers, you are not feeding, you are sitting somewhere. If your baby is crying due to hunger, obviously observe your breast will get engrossed, your breast will feel that pressure is creating in your breast, and the emotional status of a mother will not be stable. You will be feeling like you should go to baby and you should feed a breast milk, right? Am I right? Have you observed this? That is nothing but the bonding with the baby. The special bonding with the baby will be present if you are feeding exclusively breastfeeding. And postpartum benefits. What are postpartum benefits you have? Leave about sagging of breast, but if you are having a healthy diet, then with the breastfeeding, obviously the postpartum weight will be decreased. But if you are not maintaining your diet, And if you're having all junk foods, every type of food, especially these junk foods and everything, obviously you will become fat. But if you are having a balanced diet, healthy diet, then obviously through breastfeeding, your weight will be reduced, or your weight will be promoted to pre-pregnancy weight. Because some, like when I explained garbhini paricharya, I explained you, our whole body will not regain to pre-pregnancy condition, but almost 70 to 80% of your body will be preponed to pre-pregnancy condition. Because as we saw, our portion will be divided into 3 portions, right, in pregnancy. But later also, how it will be divided, some of your portion of your nutrition will be converted to breast milk, production of breast milk, right? So obviously, if you are having healthy balanced diet, your some portion is going to the baby there through breast milk. So obviously your calories will burn and you will lose a weight. But if you are having junk foods or any other types of foods which are not healthy way, then obviously your weight will be gained. And postpartum depression will be reduced through this bonding of emotional conditions. And cost benefit and convenience, right? If you're feeding formula milk or any alternative milks, you should buy them from outside. But if you're feeding a breast milk, obviously it is without any cost, and it is convenient. Wherever the baby need a breastfeeding, obviously in private area you can go and feed, right? So it is convenient to you, and it is costless, and lower the risk of diabetes, breast and ovarian cancers. This exclusively breast milk will give result in lowering the risk of obesity, one thing, and diabetes, and it lowers the risk of breast cancer and ovarian cancers, and reduces the stress, especially because if you are having good bonding of emotional condition with the baby, you can feel that. If you're feeling any stressed condition, at last what your mind thinks, leave these all. Now I want my baby and the baby healthiness. So you will leave everything. You will you will play with the baby. You will have a good bonding, emotional bonding with the baby through breastfeeding, right? So these are the benefits for the mother if she's giving exclusively breastfeeding. So this session was specially for the new moms or the breastfeeding moms. If you like the video, share with the new moms or a breastfeeding moms. Have a happy parenting. Thank you.